Good afternoon. My name is Kali Puahao. I'm from the Hawaii Employer Union's Health Benefit Trust Fund, also known as the EUTF. Today, we're happy to have been included with the HSTA's Facebook Live. We're going to talk about this year's 2025 open enrollment information. So, without further ado, I'm going to go right into it. And of course, following our presentation, if you folks have any questions, since we are on Facebook, please feel free to comment in a comment section, and we'll have folks from our outreach and training EUTF staff answer questions that you may have for this year's coming open enrollment. But let me go ahead and share my screen, and we'll get started. Okay, so we'll get right into it. For open enrollment, this year we have some important changes coming up for open enrollment. I'd like to start off with dependent children age 19 to 25 eligibility update. So effective July 1, 2025, dependent children ages 19 to 25 will be eligible for coverage in EUTF active dental and vision plans through age 25 regardless of student or marital status, and they do not need to live with the employee. Dependent children will lose eligibility and coverage as of the first of the following month, as the first of the month following their 26th birthday. Okay. So if, for example, if they turn 26 in the month of October, they'll be covered through the month that they turn 26, and then the plans will cancel off automatically on November 1. So you don't have to send any paperwork in to us. Okay, so that's some changes as far as the age. So the EUTF will no longer require annual certifications for full-time student status in regards to just to clarify, this is for dental and vision, right? For medical and prescription drugs, your dependents are still covered to age 26. It doesn't matter whether they're full-time students or not. What this change does, it piggybacks the dental and vision to have the same criteria as the medical and the prescription drugs. So dependent children eligible will be the same under active and retiree plans for medical, prescription drug, dental, and vision plans. The ETF is your during open enrollment, this is your opportunity to either enroll, or if they have been taken off plans and they qualify, re-enroll your child. Another change that's coming up this open enrollment, closure of the HMSA HMO plan. So the HMSA HMO plan will be closed to new subscribers effective July 1, 2025. Employees currently enrolled in the HMSA HMO plans may continue their coverage and can make qualified changes to their enrollments, including dependent changes, by accessing the EUTF member self-service portal that's available at eutfbenefits.hawaii.gov. An employee that cancel waives their HMSA HMO enrollment may not re-enroll into the HMSA HMO plan. Here's some important dates. So the open enrollment election period actually begins later this week, May 1, and it'll continue all the way to the 30th of May 2025. During the election period, employees can either add, change, or drop a plan. Just keep in mind there about regarding the HMSA HMO closures, they will not accept any new subscribers. Okay. They can also add or remove dependents and change their coverage tier from self to family or family to two-party. Employee enrollment change requests and supporting document submission deadline will be May 30th. So if you are making changes, your deadline to have those changes submitted online is May 30th, 2025. Premium and plan changes take effect July 1, 2025. So as employees, hey, what can we do during open enrollment? For employees who will not be making any changes, you're happy the way things are, the way they are, no action needed. Employees are not required to complete any forms to continue current plan enrollment. For employees who wish to make changes, please submit changes and required supporting documents through the EUTF member self-service portal at eutfbenefits.hawaii.gov. Again, your deadline, May 30th, 2025. And if employees do not submit change requests through the EUTF member self-service portal, they may submit an EC1 or EC1H enrollment form that's available on our website, eutf.hawaii.gov, and required supporting documents by May 30th, 2025, directly to the EUTF or to their Departmental Human Resource Office, County Personnel Office, Enrollment Designee, and for DOE employees under bargaining unit 5 or charter school employees under DOE payroll, that would be to the DOE EBU office. So it requires supporting documents, some examples of which would be uh, for yourself, no required supporting documents needed. If you're adding a spouse or partner for the first time, so they've never been on your EUTF plans before, then we need a copy of the marriage certificate or civil union certificate. If it's a domestic partnership situation, then you would send us you would complete, sign, notarize, and send to us the domestic partnership forms available on our website, eutf.hawaii.gov. If you're adding a dependent child for the first time, then we would need a copy of the birth certificate. If you're a legal guardian, the guardianship decree, or if it's an adopted child, then the adoption decree. Employee deadline to submit open enrollment change requests and required supporting documents, if applicable, is May 30th. Again, now, very important, the EUTF will not contact employees regarding outstanding supporting documents, and late submissions will not be accepted. So please go ahead and get those documents into us if you are adding dependents as far as changes you're making during open enrollment. Member self-service portal. Okay, so the website for our member self-service portal is eutfbenefits.hawaii.gov. Under our member self-service portal, employees are allowed to view their current EUTF health and life insurance plan enrollment, enroll dependents who's on their plans, compare their medical and prescription drug coverage with available plan options. You can also update your preferred method of contact and add or update your personal email and phone number with us. And of course, you can complete an open enrollment event and upload required supporting documents, as well as download your confirmation notice once your enrollment is processed, which will most likely processing of our enrollments for those that make changes. That normally takes place in the month of June, or during the month of June. You should be able to view those confirmation notices. Keep in mind, however, if you're not making any changes, there's nothing to view. There won't be any confirmation notice because we're just going to continue whatever current plans you have now into the next plan year. Plan changes and premiums. Okay, so here's some things that are new this year. So as I already mentioned, for EUTF, there's the age limiting change for dental and vision from 19 to 25. Under HMSA, here's some changes for you HMSA members out there. As previously mentioned, the closure of the HMO plans. Remember, they're not accepting any new subscribers. If you're currently on the HMO plan, you're more than welcome to stay on the plan. You can make regular changes, even changes of dependents. But once you disenroll from that plan, you can no longer go back on it. Okay. Uh, Next bullet there on the HMSA, remove the postpartum visit limitations of one per birth for maternity care under the EUTF active and HMSA HMO plans. Remove the developmental delay exclusion for physical, occupational, and speech therapy under the EUTF and HSTA active plans. Added coverage for cardiac rehabilitation at the same benefit level as physical and occupational therapy under HMSA plans with EUTF and HSTA VB. And remove member cost share up to the eligible charge and the application of the deductible for out-of-network immunizations under the HSTA VB active 9010 plan. So those are the HMSA changes. We have a few more. So our prescription drug coverage under CVS implemented hyperinflation management, where hyperinflated drugs that have readily available, clinically appropriate, more cost-effective alternatives are excluded under the EUTF active plans. Implemented the base control formulary, where utilization management was added to non-preferred products in 10 specific drug classes under the EUTF active plans. Third bullet, revised prior authorization criteria for coverage and anti-diabetics. These are the GLP-1 medications under the EUTF active plans, as well as added 100% coverage for Apretude and Descovy, in addition to the generic for Truvada. This is for HIV pre-exposure prophylactics under the EUTF and HSTA VB active plans in accordance with federal law. Keep in mind that brand name for Truvada will still require an exception since it has a generic equivalent available. For you Kaiser members, the removal of lifetime limitations for 2 elective pregnancy terminations of non-viable fetuses under the EUTF and HSTA VB active plans. And our last one for dental coverage, increase coverage for fluoride treatments to 2 per calendar year through age 19 under the HSTA VB active and supplemental dental plans. And that's it. That's all the changes for this coming plan year. Some other important information here, health plan premiums and contribution determinations. So we are in a negotiation year. I think the good news for you folks on the bargaining unit 5 is that you guys are done with the negotiations, but I'll go through the information available. So portions of premiums paid by the employer are negotiated within a collective bargaining process. The employer portion of health plan premiums are not subject to arbitration and are described in the collective bargaining agreements. So normally if settlement of employer contributions between EUTF and HSTA plans have not been completed timely, the July 1, 2024 to June 30th, 2025, monthly employer contribution dollar amounts will be used until collective bargaining agreements have been reached. Okay. For County of Kauai, their supplemental collective bargaining agreements effective September 1st, 2024 will end in June 30th. And until a new collective bargaining agreement is reached, the employer contribution will follow the terms specified in the original agreement. And then finally, again, this doesn't apply to you folks, but there's still some bargaining units out there waiting to get ratified. And we recommend that they either contact their employer or check the EUTF website for the most updated information regarding premiums and contributions. Okay, health plan selections. So as you may have seen our previous presentations in the past, we like to include some information for you folks to help select health plans. It can be kind of tricky. So here's some things to consider when selecting a health plan. The first one, of course, is well, one of the first ones as far as importance is in-network provider. So you want to make sure you select a plan that will allow you to see the doctors that you regularly go to. So check the provider listing to make sure that they have your doctors listed in whatever plan you select. Okay, that's important. Deductibles. So you want to make sure, one, does my plan have deductibles? And two, if it does, how do these deductibles work? When do they apply? Employee cost share, so your co-insurance, your co-payment. So when you do receive service, you need lab work done, you go see your physician. What's your out-of-pocket gonna look like? That's important, something to consider. The maximum out-of-pocket, so this is that maximum amount you pay per calendar year, whatever that limit is. Anything above that limit, then the insurance company is gonna pick up the rest of your services at 100% for the remainder of the calendar year. That's known as the maximum out-of-pocket benefit, a very important benefit. It helps save us financially if we have a catastrophic injury or illness. That's another important information you want to know. And of course, how much are these plans going to cost me? The premiums. So just a quick breakdown of these different topics, right? So for in-network providers, it's one thing that's good as far as HMSA plans, as well as the Kaiser plans, is that the 3 PPO plans in the HMSA, the 90/10, 80/20, 75/25 plan, all share the same provider network, as does the Kaiser comprehensive and standard plans between the 2 Kaiser plans. For deductibles, as I mentioned, this is the amount that you pay in-network providers before the insurance benefits apply. For example, the HMSA 75/25 plan has a $300 deductible per person, 900 per family, but that deductible does not necessarily apply to all services. So you need to check with HMSA to see how that works if you have that plan. The maximum out of pocket is the most you will pay in a calendar year for services. What's important to note here is that each plan's maximum out of pocket limit is different. So for the 75/25 PPO plan, it's 5,000 per individual, 10,000 per family. The 80/20 HMSA is 2,500 per person, 5,000 per family. Kaiser Standard is 25 and 7,500, right? So they all differ. So that's important to know. Your cost share as an employee, right? If you look at the HMSA plans, it's pretty much in the name. For example, the 80/20 plan for most services, you pay 20% of whatever the eligible charges. HMSA picks up the remaining 80% balance. So that's based on a co-insurance. Plans like Kaiser's Standard works a little different. So we look at that first line there for inpatient services. This is when you go to the hospital. Under the Kaiser Standard plan in the far right, it's 15% is the out of pocket for those Kaiser members. But for emergency room, it's not a percentage. They just pay a flat $100. So there's co-payment, co-insurance cost shares that you should consider. Enrollment trends. So it remains our most popular plan. The 75-25 plan, based on last year's tallies, it is our most popular plan. 41% of our membership is enrolled in that plan. And for monthly premiums, the 75-25 plan continues to be the lowest costing option for the HMSAs. And the Kaiser Standard plan is the lowest costing plan for the Kaiser members. Deadline and reminders. So again, the election period is in May this year, May 1st, and it ends on the 30th, 2025. Employee enrollment change request and supporting document submission deadline is May 30th. So if you are planning on making changes, make sure you go online and submit those changes. Any supporting documents, you can upload your supporting documents through the member self-service portal. And please do so by the 30th of May. Online resources, best place to check is our website, eutf.hawaii.gov, to view the 2025-2026 Employee Health Benefits Reference Guide. There's a picture of that there on the right-hand side. And information related to open enrollment, including plan changes and premium changes that'll take effect in July. And that's all I have for today. Thank you so much, folks, for your time and attention. We want to thank HSTA for allowing us to present the information for for this year's open enrollment. Okay.